Hello and welcome to another edition of your favorite program, Health Affair on AIT. I'm your regular anchor, Oshuomowa Danis. You're welcome. On the program, everything about health is our concern. We also focus on issues about women and children with the aim of finding lasting solutions. On this week's edition, we shall be focusing on breast cancer, its impact on patients, their relatives, and the society at large. As is usual of us, let's bring you news about recent happenings in the health sector.
On 1st October 2021, the IHR National Focal Point NFP for Venezuela reported 7 confirmed human cases of yellow fever which were investigated between 23rd and 24th of September 2021. All the 7 cases were confirmed at the Rafael Rangel National Hygiene Institute. While 3 out of the 7 cases were asymptomatic, 4 developed signs and symptoms between 20th to 24th of September. The symptoms of the fever were identified as headache, retroocular pain, arthralgia, and skin rash. The probable location of this infection was identified as a rural party locality south of the Maturin municipality in Monga State, northeast region of Venezuela. The first reported case was a young pregnant woman with a history of yellow fever vaccination, while the remaining 6 cases included 5 males ranging between 24 and 82 years of age. However, no death has been reported among the confirmed cases. The Ministry of Health of the Democratic Republic of the Congo announced that a new case of Ebola has been detected in the health zone of Buchili in North Kivu province, where a previous outbreak was declared on May 3, 2021. The case was confirmed by the National Institute of Biomedical Research, INRB, after samples were taken and tested from a young child who died suffering from Ebola-like symptoms. The North Kivu Provincial Health Authorities are currently leading a response team with support from the Ministry of Health and the World Health Organization to bring a solution to this rising situation. The U.S. Embassy Chargé d'Affaires (CDA) Kathleen Fitzgibbon has led a Mission Nigeria interagency team to Abia State to renew efforts towards HIV epidemic control. The U.S. will work with the state government and other stakeholders to close the HIV treatment gap by identifying and initiating treatment for an additional 37,000 people living with HIV in Abia State within the next 2 years. Accompanying the U.S. delegation is the Director General, Nigeria's National Agency for the Control of AIDS, Aliyu Gambo, Coordinator, National AIDS and Sexually Transmitted Infections Control and Hepatitis Program, Akudo Ibazu, and a representative of the Nigerian Ministry of Defense Health Implementation Program, General Okeji. CDA Fitzgibbon and the delegation who met with Governor Ibazu expressed the U.S. government's commitment to Abia State and encouraged the governor to build on his commitment to the healthcare system in the state, prioritize the recruitment of healthcare workers to help sustain the expanded HIV program and other critical public health services.
A dance with his family to appreciate God for 60 years of good life and peaceful years of meritorious service to the people and government of Lagos State in the health sector was indeed a wonderful way to begin a celebration. Thereafter followed the list of comments and appreciation by members of the Lagos State Primary Healthcare Board, the Nigerian Medical Association (NMA), the Medical Guild, and several others.
I'm one of your mentees. I may not be able age, but I remain a medical doctor. I must say here that I've been a good mentor. How did I get to know you, sir? During the heat of the COVID, that's the first week, there was a message that was flying on everybody's WhatsApp a DMS was going to resign and all that. And I said, who is this esteemed member who wants to resign? And then everything started coming to me. And all I saw was that you have many children, many children, and you have been a good father. I must say that you have been a good ambassador of NLA, particularly NLA Lagos. And you are one of those elders who remain past the profession and that made you a doctor. I want to use this to tell all our esteemed elders here that Dr. Erinosho is worthy to emulate.
The experience that has been garnered is going to come to good use. I've known Dr. Erinosho for so long, but I think when I appreciated him so much was during this last COVID response. I cannot quantify the efforts, the sacrifice, the experience, everything that he did to ensure that that response was a success. And even at the risk of his own health, he still continued to make sure that the best was done. We thank you so much, sir. May God continue to bless you. May God continue to excel you. Everything about you we will celebrate. Every time that we hear about you is going to be a time for us to jubilate by God's grace.
For them, even though Dr. Erinosho has retired out of public service, he will remain a reliable and dependable hand for the health family in Lagos State and even at the national level.
Today we celebrate your illustrious, impactful and unblemished career as a thoroughbred public health physician in the service of Lagos State. You came, you saw, and you conquered. Since October 1985, when Dr. Erinosho joined the Lagos Local Government Service Commission as an Assistant Medical Officer of Health and in other postings, including serving as the Pioneer Secretary of the Lagos State Primary Healthcare Board and as the Director of the Disease Control Lagos State Ministry of Health, among others, he distinguished himself and displayed an unalloyed commitment to work and utmost professionalism. Here is to wish Dr. Erinosho the very best as you retire from the service of Lagos State Government. Happy 60th birthday.
He has been very indispensable, but he still has to retire, so I'm happy for him that he's retiring on a very high note.
Dedicated, thoroughbred Ife graduate. He's very humble, and he knows what it's all about. He's a medical practitioner and community medical practitioner, and he's somebody that should be kept in the service, not just as a worker, now at a different level, because he still has so much to offer. He's a superstar.
We were appointed together 1st of January 2020, and we've served on the board of the Lagos State Health Management Agency together. And in the few months that I've known him, he happens to be somebody that is very cool, very calm, very collected. And in all our deliberations, we actually depend on him so much, especially when it comes to the knowledge that he has, especially in the areas of the primary health care development in Lagos State. He's somebody that is quite educative. At every point in time, he gives you facts, and we always depend on him. When he's not at the meeting, we miss him.
Born 18th of October 1961 at Abeokuta, Ogun State, Nigeria, Dr. Ashimiu Erinosho has served in various capacities in the private sector and with the Lagos State Ministry of Health before he was made the Director, Medical Services and Disease Control, Lagos State Primary Healthcare Board, a post he occupied till his retirement.
It's their birthday, and I'm also marking my last day in office. I'm Lagos State Government. I've been in service for 20 years, and I take this opportunity today. I'm retiring from the service. and I give glory to Almighty God, and I thank Lagos State Government for the opportunity that they give me to start the state government in various capacities for the last 7 years. It's been a wonderful experience.
His passion for a successful primary healthcare system was further demonstrated by his message of teamwork and the need for Nigerians to imbibe good health-seeking behavior.
As part of efforts to ensure that the African continent improves on its preparedness and brace up to the challenges posed by emerging infectious diseases and biosecurity threats, the Lagos State Government, through the Ministry of Health, in partnership with a non-governmental organization, Global Emerging Pathogens Treatment Consortium, GET, is set to hold the 7th Annual African Conference on One Health and Biosecurity. The conference, which has the theme Universal Approach to Addressing Biosecurity Threats, Genomic Intelligence and Vaccines, is scheduled to hold at the Civic Center, Lagos, between Wednesday 27th and Friday 29th October 2021. The State Commissioner for Health, Ashimiu Erinosho, while giving details of the conference, said the conference is the 7th in series of conferences organized by the GET in partnership with government around West Africa and the African continent. He explained that the need to continually emphasize the key importance of the African response in combating emerging infectious diseases and advocating treatment strategies against future biosecurity threats informed the need for this.
I'm really impressed by what I've seen today. I enjoyed the visit because this is really something we've been looking at since the beginning of the pandemic. We've seen that Lagos State has done a lot.
Members of the diplomatic community in Lagos have scored Lagos State Government high on its COVID-19 response and management effort, which have seen the state overcome 3 successive waves of the global pandemic. Speaking after meeting with team leads of the Lagos State COVID-19 Incident Command Structure and the Emergency Operations Center at a tour of the Infectious Disease Hospital and Biosecurity Facility Yaba, led by the Commissioner for Health, Ashimiu Erinosho, members of the diplomatic communities agreed that the state government has done a lot to mitigate the scourge of the infection. They equally pledged their support to the COVID-19 Lagos response directly and indirectly. The Consul General of France in Nigeria, Laurence Montmiron, who made this known, added that she's impressed by the biosecurity facilities that were put in place at the IDH by the state government to prosecute the war against the global pandemic.
A human rights lawyer, Monday Ubani, has called on the federal government to review the process through which Professor Musa Olomu's tenure was renewed. The lawyer, who has over the years consistently championed the protection of the rights of the common man on the street, including their right to good health through adequate provision of health infrastructure by the government, noted that the reappointment of Professor Adewale Musa Olomu of the Federal Medical Center, Abeokuta, for another 4 years, despite the institution's board indictment against him for alleged act of age falsification and gross misconduct, is another form of corruption which, if not reviewed, will certainly dent the image of the Buhari-led administration.
I'm doing this because we have a government that had made promises. And part of the promise that this government has made when they were coming is that we will fight corruption. We will not allow anything that is clearly untoward to happen in any of the government agencies. We have a man who has actually altered his age, and they have found that out. And he himself even admitted it. The first age declaration was done by his mother, saying he was born in 1960. When he was now entering into service, he now have his own father now swore an affidavit, saying that he was now born in 1964. Now, they didn't make reference to the earlier declaration where he was alleged to have been born in 1960. If you have made reference to it, it would have made some bit of sense, but he didn't make reference to it. So why were you altering that age for issue? In order for you now to probably stay beyond the normal number of years you're supposed to last in the public service.
Some concerned members of staff of FMC Abeokuta sometime last year, petitioned the board of the hospital and the Federal Ministry of Health, alleging age falsification, abuse of office, and mismanagement of hospital funds against Professor Adewale Musa Olumu. After a painstaking investigation where all parties, including the medical director, was given the opportunity to defend themselves, the committee found sufficient evidence against him.
Old practice where public servants flagrantly violate the public service rules, regulations, and government circular without punishment is something that we should discourage. Now, our health system is too important and critical to be handled by persons of questionable character. Federal government should also investigate the circumstances under which the Federal Ministry of Health suppressed the letter of the board to the Ministry, Office of the SGF, that's the Secretary of the Government of the Federation, withdrawing its earlier recommendation of his for his second tenure, which was written before the petitions that came in were investigated.
Though the Chief Medical Director and the Public Relations Officer of the hospital refused to speak with our crew on camera, they however countered the press release of the human rights lawyer Monday Ubani by saying that the appointment followed due process.
According to the World Health Organization statistics, about 422 million people worldwide have diabetes, with 1.6 million deaths associated with diabetes each year. Oluseyi Kazem, a native of Ilobu in Irekodun local government area of Osun State, is a victim of diabetes, who has also lost his father as a result of diabetes complication. He wants Nigeria to prioritize their health and care for people living with the condition.
I should be here because it's something that I'm so conversant with. I lost my dad through the diabetics, and I've been trying to be careful. And I know this thing is hereditary. I've been trying to be very careful to make sure that at least I need to monitor it as well.
In response to the growing concerns of the health and economic threats posed by diabetes, Lions Club International organized free diabetes screening and testing in northern and southern states of Nigeria. They encouraged residents of the state to engage in frequent exercise and regular medical checkups to ascertain the status of their health.
It's the turn of Osun State, which is District 404B2 Nigeria. This is why we are here. We want to create awareness for diabetes in our society, so people will be aware of diabetes. Early detection, of course, will help a lot.
Lions Club International is a charity organization, a service organization, and focuses on assisting the needy in the public. But there are 5 focus areas that are major in the activities that we provide. Diabetes is one of them. Looking after the environment, pediatric cancer. We also do vision. But about this particular activity, the diabetes, we found out that the incidence of diabetes in Nigeria is very, very high. Unfortunately, many people are not even aware that they are living with diabetes. From statistics, even though rudimentary as it is, we found out that 10% of urban dwellers have
diabetes has been identified as one of the greatest killers of human beings around the world. Unfortunately, also it's a silent killer, and so many people are carrying it about without knowing they do. So what we are doing here is to allow people to know their status, so that when they know their status, they'll be able to manage it effectively.
The program is targeted at screening 150 Nigerians to reduce the incessant increase in the number of diabetes cases. Olatunde Olayiwola, AIT News, Osogbo.
Amid the current global burden of visual impairment and blindness, it has been predicted by some experts that nearly everyone in the world will experience an eye health issue in their lifetime. Yet, an estimated 1 billion persons do not have access to eye care services, especially in developing countries like Nigeria.
It's pertinent to note that globally, 2.2 billion people have visual impairments or blindness. 1 billion of these cases could have been prevented. In Nigeria today, the prevalence of distance vision impairment in low to medium income regions, including all parts of Nigeria, is estimated to be 4 times higher than the high income regions. If priority attention is not given, the number of blind and severely visually impaired adults in Nigeria will increase by over 40% in the next decade. The implications of visual impairment cannot be underestimated, as it places enormous economic, social, and psychological burden on sufferers, families, community, and the nation at large. We plead for improved funding of the eye care sector by the government, creation of more job opportunities for optometrists at all levels to cater for the need of the teeming population who need eye care services, compulsory driver's license eye examination program, compulsory pre-employment eye examination, import duties waiver for ophthalmic equipment, inclusion of all stakeholders, including the Nigerian Optometric Association, into the recently constituted healthcare sector reform.
Children are not excluded from the burden of visual problems, as 1 out of every 3 children in Nigeria has an uncorrected visual impairment which affects school work and learning.
So, but in today's world, we are having more and more children actually having more eye-related problems, especially because now they are exposed to visual display units, computers. They are doing a lot of there's a lot of visual demand, or eye. When I say visual, I mean eye demand on their eyes. So in fact, there was a survey that was done in the US, and they have actually said that maybe in the next by 2050, that we are going to see that half of the world population may be wearing glasses due to myopia. Myopia is short-sightedness. So we are seeing lots and lots of children becoming a bit more short-sighted than ever before. This factor increases when the parent wears glasses. So a lot of children are ignored. You know, nobody must be left out.
Establishment of preschool eye care initiative. In other developed countries in the world, a child must have his eyes tested at least 3 months after they are born. And they must have their eyes tested before they get into any form of education. This is what we are pleading to happen in Nigeria. Establishment of eye clinics at all primary healthcare centers across Nigeria to be manned by optometrists. With over 5,000 optometrists, we have the personnel to cover every public health institution in Nigeria.
If we can tackle cataracts and glaucoma as far as Nigerians are concerned, will go a long way to improving our eye health. And this World Sight Day will be a great achievement if we are all aware and then we do what we are meant to do as far as eye care is concerned.
Every second Thursday in October has been designated by the global community as a day to draw attention to the global burden of visual impairment and blindness.
When you love yourself, you want the best for yourself. So when you love your eyes, you want the best for your eyes. And we know that the eyes are a precious gift. It's a window. They said it's a window of the soul.
The 2021 theme, Love Your Eyes, Save Your Sight, was carefully selected to awaken people's consciousness to preventive eye care. October 10th every year is designated by the World Health Organization as Mental Health Day. The overall objective is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. Speaking in reaction to the 2021 theme, Mental Health in an Unequal World, some experts expressed concerns on the need to address poverty.
And this is quite instructive, considering the fact that the global COVID pandemic brought to the fore a number of inequalities globally, and Nigeria was no exception. The inequalities include access to health care, including mental health, and also the at-risk groups, quite disparity between those who are in the lower socioeconomic class This also has implications for the post-pandemic era as well, as it's envisaged that these inequalities will only increase. And so this has implications for mental health, and particularly those who their etiology of mental health problem is driven by poverty, which impacts on their access to quality healthcare in general, and including mental health care.
There is disparity between the rich and the poor. The poor hardly get access to medical facilities, especially mental health. The poor are stigmatized. And then most people that has mental illness, over time they become burden to their relation. They abandon them. And if you don't have money, you can't continue. And bringing this team will help us to talk about it.
The 2021 theme, Love Your Eyes, Save Your Sight, was carefully selected to awaken people's consciousness to preventive eye care.
This is the Ikoyi cluster of the 13th Arise Walk for Life, Lagos, Nigeria, with over 100 participants, including the convener, Dr. Shiju Iluyomade, and her husband, Pastor Idowu Iluyomade.
The work held in several clusters simultaneously across the state and other countries of the world.
I choose life means that you're able to make decisions which pertain to your life, to decent living, to be able to choose good health and longevity. Because if you continue to walk and you build up even your metabolism, it is proven that you live longer. Find out that your lungs function better. When you're out walking in the sun, you get in vitamin D. And with us in this period, the COVID period, we have seen that all of this aids you to get better quicker if you should fall ill. But invariably, you really should not fall ill. So that's what we are praying and hoping. But once our body is functioning at optimal, then it will be okay for all of us. Number two, which is what we often overlook, is that walking doesn't cost you anything. All you need are your 2 legs and you get moving. And so I encourage everyone to walk.
We've done 3 kilometers from St. Saviour's down the bridge, the Lekki Bridge, and back to Ikoyi. We dance, we exercise, we meet, we mingle, and we marry. And so it's been fantastic.
I have to walk and play. We walked, now it's time to just relax. Body aches and pains, but you need aches and pains before you get the strength and the six-pack that you're seeing right now.
This is my fifth year, being part of the family. And we have all agreed that, you have to spare, 30 to 45 minutes of your day, to work out and keep fit, and it's incredible. You cannot get better than this. There's a lot of obstacles going on around the world and in Nigeria especially. And for you to have a place where you can come, and meet different kind of people and have fun, it's very, very encouraging.
To get the maximum benefit from exercise, the organizers noted that good nutrition remains a key element.
In all of it, you must be able to balance everything. Your exercise regime, your dieting regime, and the time you eat must be regulated.
It is the desire of God that we are in health so that we can achieve all-round success in life. We don't have any other body except this one that you have. So you are supposed to take care of it, control your appetite, control your weight, control your sugar intake, then hydrate the body.
Arise Walk for Life has been on for 13 years with a central message on preventive health care, especially for women. The theme for this year is I Choose Life. Welcome back. October is International Cancer Awareness Month, another opportunity to draw the attention of all to the waste of precious lives and resources as a result of the huge gap in Nigerians' health infrastructure, especially the infrastructure for cancer care. According to the World Health Organization (WHO) 2019 report, cancer was the first leading cause of death before the age of 70 years. There were 10 million global cancer deaths in 2020, with 70% of these deaths occurring in developing countries like Nigeria. Most of these cancer deaths are often due to late detection, hence the need for continuous awareness. I spoke with a cross-section of stakeholders who have had close experience with breast cancer. Before the discussion, let's bring you some clips of these stakeholders and what they've been doing since the beginning of the month to raise awareness about breast cancer in Lagos State.
So Checkout is a parenting group with mothers and fathers. We're passionate about how we raise children, parenting generally, and of course we cannot detach parenting from things like this because cancer is something that affects men, women in their days of life. So we decided to create awareness because we realized that despite the fact that almost everybody knows about cancer, there are still some misconceptions or misinformation about cancer, and we would just like to be out here to tell people that cancer could affect, as you can see, we are all different sizes, different shapes. So cancer can affect anybody. There's no particular sex. Or to wage war against cancer, just get tested. It is simple. If you see anywhere where you can get tested, either for free or for a very subsidized rate, please just get tested. It's always better to know than not to know and be eaten up by the disease, because one thing about it is once it eats you up, it's usually practically impossible to get rid of.
People are diagnosed each year for cancer, and we have come out today to do this awareness to get people to understand the importance of testing, getting screened and all that. It's very important because early testing and screening go a long way in effective treatment of cancer, because most of the major challenges we are having right now is that people don't get tested. So we are here today, out here today, encouraging people to go out, to get tested. Early treatment is still the best way to manage cancer.
I've had some experiences with breast cancer. I've had a friend with breast cancer, and I've also had one friend survive breast cancer. So I'm intimately aware of some issues that go on with breast cancer patients. Specifically, I believe that breast cancer scans should be available to all women, especially women, and treatment options, alternative treatment options, should be made available to all breast cancer patients. It's really tough when you hear that breast cancer instruments for treatments are either too few or non-existent, so much that some breast cancer patients have to travel all the way to Ghana. I think not just the government, but also non-governmental organizations and the public at large should join hands so that this doesn't become an epidemic for us in our society. Otherwise, one day it might just be a thing that affects me or affects you.
And we have on the show with us today Oladimeji Abodure. He's an advocate for breast cancer. You're welcome to the show. You're a man, and when we talk about breast cancer, we want to see women and all that. So what's your interest about breast cancer?
Yeah, thank you very much. I happen to be in a group with a couple of friends. It's called 18 to Checkout. So what we do basically is parenting. So amongst ourselves, we kept thinking, this cancer thing we're in back and forth, people are not even, being aware of it enough. What can we do? And we decided to come together and be like, see, let's take it up this cancer month. Let's talk to people about it. Let's know, because there's even a wrong notion that breast cancer is only about women, which is actually not true. That breast cancer is killing our women, it's killing our mothers, and then men also. So I think it's time that we take actions. First of all, we can't leave all the action to the government. We have to test ourselves and be prepared. We have to actually test ourselves occasionally and then be sure that, you make yourself healthy enough. Also, there are different things that can even make it worse, that can spawn the body in that direction of the cancer. So basically, we would say, whatever lifestyle you're living that can actually make it go worse or go by, the different modes, smoking, whatever, taking some substances, which are very dangerous to the health. So that we'll preach here healthy living, healthy lifestyle,
I am Uche Onunkwo. I'm a journalist, a writer, a storyteller, a producer too, and a mother. And well, yeah, this is all about breast cancer, but I won't say I am a survivor. Just I haven't had a close shave. I've had a distant shave. It's breast lumps, not breast cancer. It was quite by accident, I had this crazy fever, and then I felt this horribly sharp pain around my nipple, you know, and I was nursing the pain when I felt this lump, you know, and then I, you know, checked closely. I actually felt 2 lumps there that didn't used to be there, because I discovered this when I was 16, yeah. And before then, we've had exposures to breast cancer awareness, you know. So now and again, I did my self-examination, you know. And so when I was familiar with my breast region, so when I felt that lump, I knew it was something different, you know. And so began my journey with doctors. The first doctor I consulted with told me straight up that I had breast cancer and I had a very short time to live, you know, and that like killed me in itself, you know. And for months that I was with him, he was just treating, he gave me stuff to consume and said he was just going to manage me until the day comes, you know. But I began to read up on breast cancer and breast lumps and all that, and so I knew that, okay, since he hadn't tested this lump, there was a chance that it could be benign, not malignant. If it's benign, that means it's just a lump that doesn't mean any harm. But if it's malignant, then that's breast cancer. And so I kind of consoled myself a bit that, hey, this might not be breast cancer after all. And so I went on to consult with other doctors. And in fact, the doctors laughed at me and the previous doctor, who just from out of the blues concluded it was breast cancer. And then, yeah, I was supposed to do a biopsy. And well, I was scared, you know, so I didn't go ahead to do that. But the doctor placed me on some medication, which in all sincerity I didn't take seriously at the time. And then I somehow navigated to Dr. Elizabeth Kafaro in her days. I carried this lump for about 8 years. And I breastfed my first 2 children with the lump in my breast, because somewhere along the line, I don't know how I got to psych myself that no, this isn't breast cancer, this is just a benign lump I was carrying. And somehow I breastfed my children until I began to feel that nudge that, hey, when you carry, because I knew also when you have a lump for too long, it could become malignant and that becomes dangerous. So some 8 years after I discovered it, you know, that's I was 24 when I took it out, and, you know, and then we tested it. It was benign, and so I felt safe. I was happy.
But that period, you had to bring up and down, going to Elizabeth Kafaro, going to take about Lynch and all that. What was it like life generally?
Life was more exasperating in the days before Kafaro. What I'll say to women, please check. You know, we're supposed to check every month. I think it's after your menstrual cycle, if I remember clearly now. You know, check every month, women out there, because our lifestyle these days has, you know, automatically predisposed us to cancer already. The food we eat, the air we breathe, a lot of the things we do, you know, so we are already prone, you know. So I would tell you, keep checking, and if you feel any difference, if you keep checking, you become familiar with your breast and the tissues around there. There are things that feel like lumps, but they're indeed just tissues, breast tissues. But if you keep checking, you will know when there's something different, and please hurry to your doctor. Get it, have it checked, have it removed. You know, from my reading here and there, from my little research, I have come to understand that doing a biopsy while the lump is still in your breast is more dangerous than even treating cancer, because if it is cancerous and it has been contained in that cocoon of the lump, when you inject it, I mean, I don't know, the sciences can, you know, prove me wrong, all right? But from what I have read so far, when you pierce a needle, it punctures the sac that contains it. And then if it's cancerous, it just begins to escape and then spread, and then the spread is faster and it's more dangerous. You know, so if you have a breast lump there and you're not comfortable with it, take it out. Just take it out and then have it checked. I have a friend who had to take out both breasts. I mean, she cleaved out everything because she had breast cancer. That was her only option to survival. And she's done 2 years now since then, and she's good. Doctors had to take tissues from here and there to fill that space up, and she's good. She's fine, she's a mother, you know.
And for those who think that is a death sentence, let them know that if they check and discover on time, that's the remedy.
Yeah, early detection is the solution. Breast cancer indeed is not a death sentence. Early detection, your doctors, I mean, there are so many options out there these days of things to do. But, I mean, that's the essence of checking. Once you find out, see your doctor, they do something, it isn't a death sentence. There's so many breast cancer survivors out there on the streets, you know. So, please, ladies out there, I will say check, check, check. Keep checking. That's your first lifesaver. Check, check, check. You find a lump, go see your doctor. I narrowly escaped this, even though I'm thankful it wasn't malignant, but please, I won't even advise anyone to go the route I took. Hit the hospital, have your doctor do something about it.
Thank you very much for coming on this show.
Thank you to you. I appreciate it too. Thank you.
If you are just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment. Today, it will be a discussion on lifestyle habits and what to avoid in your diet.
When we talk of diet, number one ingredient we talk of the diet is salt. Salt, the more salt you take, the more tendency is for you to have hypertension. And as scientists, we recommend that you should take salt less than 5 grams daily in your diet, in your food. Or you should not add salt to when you prepare your food. There are some ingredients that are laden with salt, especially those ingredients that are available in the kitchen. You should not add them to food. A lot of them are laden with salt. So, if you want to avoid salt, there are certain vegetables you can take that can also give you the same amount of taste for your mouth. So, try to avoid salt as much as possible. Then, we also talk within the diet, we talk about too much fat in the food is also bad, in terms of when you are talking of diet, because that also can affect the arterial wall, the walls of the arteries. It can make them more thickened and can make also more thickened to hypertension.
In our clinical segment, we give you tips to stay healthy.
Symptoms of cancer generally are non-specific, and they are particularly related to the area of where the cancer is developing. So if a woman has breast cancer, we'll be looking at a breast lump, swelling in the breast. If it's cervical cancer, we'll be worried about things around that area of the woman's body, which is in the private parts. And we would not want to stress on the symptoms, because by the time women are noticing these symptoms, it is too late. That's why the focus is on prevention. Before the symptoms start appearing, women should turn up and do screening. Let us, the doctors, the nurses, pick up the signs, the issues that may be going on in that person's body, whether it's the breast or the cervix, before the patient starts feeling the symptoms. But for academic purposes, people ask what are the symptoms of cervical cancer. I can reel them off on my fingers. One is a discharge that is not going away. Bleeding. Women are supposed to bleed periodically. That's why we call it period. But if it's no longer periodic, bleeding every day, everywhere, anywhere, it is not acceptable. Bleeding after intercourse. Women are not supposed to bleed after intercourse. We call it postcoital bleeding. It's a sign of cervical cancer that there's a problem. Women bleeding after menopause. When women finish their period, they reach a stage called menopause, the end of periods. But women start bleeding again after they've already said bye-bye to period. That's called postmenopausal bleeding. When the cancer has now advanced away from the cervix area, it can now start affecting the pipes, draining urine from the kidneys. and cause total blockage of urine passage. That is the final stage, and that is not acceptable.
We welcome your contributions on how to improve the nation's health sector and human lives on our perception segment.
People that have too much money are people that are benefiting, but they can afford of going to abroad, get themselves treated. But we now, as I'm coming out now, because I don't have too much money, I'm not financially buoyant enough. That's why I just go where they are selling abo, buy abo, drink for malaria. You understand? In a way that they can make the thing better is that let's General Hospital, where people normally go and take treatment, be okay for people, so that whenever you are sick, you can go down there and take a card, meet a doctor, the doctor examine you and tell you what is happening to you. Then the prescription, they write the prescription for you. If you can buy it at the hospital, there you buy it there. If you cannot be able to buy it there, you can go to elsewhere and buy the drugs so that you can be healthy.
The best thing, if President Muhammadu Buhari can stop it, that nobody should be flown out of this country if the person is sick because of any reason. They should be patronizing. We have private hospitals, we have general hospitals. Let them go there now. The general hospitals, the private, are not meant for animals, it's meant for human beings. So let them go there so that they will see what we are facing. At least if you go there, even the condition you see there, so that might even tire you.
They are trying. At least for the new government we have now, they are really trying. Unlike before, when you go to general hospitals, stay hours. But presently now, the presently government we are having, they are really trying for us. God bless them, they should keep on. Doctor aspect of it, let them work towards that area. They should stop going for strike every time.
This is where we draw the curtain on the program today. Please kindly support the program by advertising your health products and services at a very subsidized rate. My name is Ashimiu Erinosho. See you same time next week. Please keep staying safe.